Hi everyone, welcome to the next screencast for the course. As you can see by the slide here, this is in regards to communication, and obviously underneath here we have a quote that says, "A health professional who is a good communicator respects their or his patient." So this is a little bit of add-on to what we did in second semester in regards to communication. If you remember, we spent a considerable amount of time on understanding how to communicate with our patients and with our peers and so forth. You'll see here on the next slide there is a YouTube talk here. I will be discussing this on Friday, so please take the time to click on this on your slides, which are in Blackboard, and have a listen to it. It's very intriguing what he's talking about. He is utilizing sort of art as a form to think about communication, but ultimately, as you get through it towards the latter part of his discussion on it is a TED Talk. You'll start to get a sense of what he's trying to get at, which is very important. And I think it'll sort of highlight some of the things that I talked about back a number of semesters ago when we think about communication with our patients. So obviously, if we think about our communication within the field, our basic communications, the majority of the time, is between a therapist and a client. So, what kind of communication is happening between you and a client? So it could be pre-treatment stuff, so having that informed consent and so forth. It could be the sensitive areas, so having a discussion and communicating about areas that you feel are appropriate for the clinical presentation that the patient brings in, including nonverbal. So we talked a lot about that second semester in terms of how you sit, how you hold yourself, how you look at a patient, and so forth. Communication can be difficult feedback from them. It can also result in inappropriate behaviors, either between the therapist and the patient or the patient themselves. The other thing that it helps with our thinking in trying to head off any kind of problems. So maybe past negative experiences with another healthcare practitioner. So they're bringing something that's happened to them at some other time in their life, and they have a problem. And then, of course, incomplete health history information leads to, a high potential for bad communication. You're left maybe making some assumptions. You're in the middle of something, and the patient says, "I have this. Is that important?" Those sorts of things. So we have to bring all these things in mind when we think about it. When we look at communicating, we have to remember a number of things. That is obviously being clear and transparent. So you need to be very understanding and make sure that the patient or the client is understanding what you're saying, and that you are being extremely transparent so that there's nothing that's going to happen within the treatment session that the patient is not aware of. The other thing as well is we talk a lot about this, in preparation for OPs and so forth, is talking to your audience. So, if you're going to think about speaking to a patient in the clinical setting, you are not going to have an opportunity to be using the words like you might use if you're talking to me. Now, if you've got someone who's, a healthcare practitioner that you're treating, of course you can use the words that we normally use in class. But if you have someone who hasn't got that kind of background, you have to think about how you're going to communicate what's happening or what you're planning on doing at the level of your audience. Practicing with empathy. This goes back to hopefully the video that you watched, because the gentleman in his talk, TED Talk, actually spoke a lot about what's happening with empathy in the way we train physicians. And I thought it was quite intriguing that he is suggesting that we actually break down empathy. And when individuals are coming into school to become a doctor, and they are very empathetic and quite energized to help patients, and we knock a lot of that down because of the need for them to be perfect. Asking questions, of course, lots of them, because if you're not clear, you want to be clear. So don't be afraid to ask questions to show that. Within the context of these, it does demonstrate to your patient that you're respecting them and their requirements. So understand that, through what you're doing here, through the words you use, that you're demonstrating your respect for them. The last part on this slide is one of the hardest things to do as a clinician, and that's being okay with silence. You must have silence in a sense that allows the patient to think about what they're saying. So if you ask a question and the patient is quiet about that question, give it some time before you actually maybe have to clarify with the patient about whether or not they understood your question. Because it could be quite as simple as they're trying to come up with an answer to your question, so they need the time of silence to think about how they're going to answer it. Extensive research has shown that no matter how knowledgeable a clinician might be, if he or she is not able to open good communication with the patient, he or she may be of no help. What that's basically saying to you is that the cornerstone of treatment is communication. Because through communication, everything gets clarified. You have a better understanding of what your patient's desires are and what their needs are. You just have to make sure that you always keep a good line of communication with your patient. The other communication that we have to do is this interprofessional work that we will likely find ourselves in when you leave here and you start to practice. So good communication, of course, is between professionals within this. Obviously, interprofessional work helps for good patient engagement. So if there's more than one of you looking after a patient or within the treatment plan, obviously good communication between you and other professionals just improves patient engagement. Population health approach helps a lot as well as that goes. So in terms of looking at the population, communication gives the best possible care and services. It keeps us working together so we get a better understanding of each other's work and therefore create better treatment plans or offer better services for our patients, which leads us to access. As well, in interprofessional teams, we want trust and respect between each other. So you want them to respect anything that you might be saying, and you definitely want to respect, work on respect of what they're saying. So we want to move in that direction. And of course, all of these are part and parcel of effective communication in terms of your ability to share and have discussion around patient care and needs. So when we look at collaboration from the interprofessional part, we want to collaborate on the business goals. So what is the goals of the business that you're working for? Any kind of strategy. So we want collaboration. Hopefully we're including people in the strategies of what we want to do, both personally, professionally, and in the group setting. Part and parcel of that is, how do you choose potential collaborators? Where do you look for someone who has the potential to be a person you'd wish to collaborate with? We'll talk a little bit more about that on Friday, but something to think about. The other thing, of course, is from a collaboration point of view, is establishing a working relationship with someone so that, again, avenues of communication are smooth, they're easy, and moving back and forth. Another thing that can happen from an interprofessional perspective is something what could be in a written sense. So you could be giving a letter of introduction. So, dear Dr. Such and Such, thank you for referring Mr. Brown to me, blah, 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 and so on and so forth. So I think we'll talk a bit about that on Friday. A letter of progress is, of course, you are in some ways collaborating and communicating with someone who's been has referred someone to you about where they are in the program, what expectations are, what kind of results you're seeing as they move through the treatment plan. And of course, occasionally, as you know, through your informed consent statements, that you may sometimes be referring a patient to someone else. So you will be referring and writing information within a referral letter. So here's what I would like you to think about for class on Friday. I'd like you to make a bit of a list of what kind of things would you include in a letter of introduction, what kind of information would you include in a letter of progress, and what kind of information would you include in a letter of referral. And we'll discuss that on Friday. So when we look at further collaboration, such as the association, Registered Massage Therapy Association of Ontario chapter, is an opportunity for you to talk with colleagues, people who are doing exactly what you do. So what could be better than collaborating with people who speak your own language? And within the RMTAO, we have these community-based networks. And if you go on the RMTAO, you will see that there are areas of the province that have sort of divided up that have these established networks. I would highly recommend you take the time to join the association, because it opens up so many avenues to you in terms of finding jobs, getting liability insurance, getting further education, finding areas of further education. So people advertising there what kind of courses they're offering, and it just opens up avenues for you. We'll have a look at the RMTAO site on Friday. I don't know how many of you are signed up, but it is certainly something you need to consider. Thanks for that. This is on communication. We're going to be doing two parts, 2 weeks and 1 week this week. So there will be another screencast coming. Thanks for your time, and we'll see you on Friday.